Hello and welcome back to another episode of Let's Learn PT. Today we're going to be covering two different metabolic disorders. And both of these metabolic disorders originate from the adrenal gland. So they are a result of adrenal dysfunction. The adrenal gland is obviously a gland that is just off of the kidneys that releases the hormone cortisol. So first I'm going to dive into the physiology, because in order to understand any pathology, we have to understand the underlying physiology and its effects on how the patient's going to present. So, like I said, Cushing syndrome and Addison's disease are the two metabolic disorders we will discuss, and they are a result of adrenal dysfunction. And this adrenal dysfunction is resultant from an excessive or lack of adrenocorticotropic hormone from the pituitary gland. The pituitary gland is essentially a mastermind metabolic gland that releases hormones that excite or inhibit other metabolic glands to release their hormones. It's the controller, the supervisor of the metabolic system. So it releases adrenocorticotropic hormone, and that hormone tells the adrenal gland to release cortisol. So if it releases too much or too little, our cortisol levels will be thrown off due to that adrenocorticotropic hormone exciting our adrenal gland or inhibiting our adrenal gland's release of cortisol. So now that we understand what's going on with the adrenal gland and subsequently the pituitary gland, let's talk about what cortisol does inside of our body and its role in metabolism and glycogen. So cortisol breaks down glycogen into glucose and glucose phosphate 1, and it promotes our fight or flight response associated with stress. So we have a stressor, and our autonomic nervous system kind of turns on our fight or flight, which elevates our heart rate, elevates our blood pressure, and prepares us to react to whatever that stressor is. It also helps regulate blood sugar and metabolism. So now that we know what cortisol does, we can kind of get an idea of how too much cortisol in the situation with Cushing syndrome or too little cortisol in the situation with Addison's disease can affect our body and how it'll present in our patients. So, like I said, Cushing syndrome is hypercortisolism, too much cortisol in the system, and it results in hyperglycemia because this breakdown of glycogen into glucose, therefore we have an elevated blood glucose level. Truncal obesity, again, because of that elevated blood glucose level and that excessive breakdown of glycogen. A buffalo hump and a moon-shaped face. Both of these are related to fatty deposits in the body because of excessive cortisol. A buffalo hump is in our cervical spine, just superior to right in between our shoulder blades or our scapula, and we present with a hump here that is a fatty deposit. Moon-shaped face is a rounded out moon-shaped face that is resultant of fatty deposits in and around that facial tissue. Weakness, hypertension, again, a prolonged period of too much cortisol, too much of that fight or flight response, and a prolonged chronic increased blood pressure resulting in hypertension, and poor wound healing. Just like with diabetes, if we have hyperglycemia and a high blood glucose level, our potential to heal wounds is going to be significantly diminished. Now on to the opposite end of the spectrum, Addison's disease, hypocortisolism, too little cortisol in our system. We are going to have a metabolic dysfunction because the cortisol in our system helps regulate our metabolism. So because we don't have adequate cortisol, we have troubles with our metabolism and functioning properly. Electrolyte imbalance, hypotension, again because of that fight or flight response. Too little cortisol in this case will cause too little of the fight or flight response and a significantly lowered chronic low hypotensive blood pressure. Weakness, and then anorexia and weight loss. So anorexia and weight loss are a result of this breakdown of glycogen. Our body can no longer efficiently break down glycogen because we have low levels of cortisol in our body. Therefore, we lose weight and may even result in subsequent anorexia. Two things I want to mention that are important tidbits for the licensure exam and also for clinical practice are that with Cushing syndrome, Chronic overuse of corticosteroids can actually result in Cushing syndrome. So if you ever encounter a patient who's presenting with these symptoms, it's good to look to their prior medical history and understand if they've been on corticosteroids for a long period of time. And with both of these, secondary to cortical therapy, either the replacement of cortisol in the system or the opposite, orthostatic hypotension is common. So just being aware of positional changing precautions and safety precautions that are related to orthostatic hypotension. So that is what I got for these pathologies. Both of them result from adrenal dysfunction coming down from adrenocorticotrophic hormone from the pituitary gland. And once we understand all this, understand how cortisol works in the system, once we see these and we understand, link them to hyper or hypocortisolism, we can immediately infer what's going on with the patient, how they're presenting, how it's affecting their function, and how we can help them as clinicians. Thank you guys for watching. Like, subscribe, follow us on Instagram at lets_learn_PT, and I'll keep pumping out content for you guys. Leave a comment below if you want to see any specific video. Thank you.